I saw this city in contrast to the other places that I'd worked in, and the problems of the urban poor are so much more complex and so much more magnified. I think the primary reason being what is premium in this city, which is space. So our slums are so much more congested, and all the problems or issues that arise due to that get so much more magnified. The dearth of physical spaces in the midst of slums, particularly for women and children, safe spaces which women and children could call their own, and then to weave around an activity-centric format which makes it a habit for them to come and then gradually focus on their development needs, mainly health and capacity building. What one saw at that time was that for long-running and high-cost treatments, poor people had to shell out a lot of money. And the same thing for education. Like the government was investing a lot on literacy, on primary education. But when those very children, when they grew up and there was so much of potential and the high performers amongst them, suddenly there was a bottleneck because the state had assumed the role of being a permitter rather than the creator of institutions. So there were very high fees for students wishing to pursue higher education. And also if you went to government hospitals and there was a major ailment, there was a user fee, and that user fee kept on increasing over a period of time. We have 8 community centers in the slums of Mumbai. We have 3 in Jogeshwari. The first one at Premnagar Andheri plot, the second one at Shiv Tekri, and the third one at Caves Road, which also doubles up as a training center. Then we have 2 in Andheri at Mahakali and at Pump House, 2 in Malad at Anandwadi and Pathanwadi, and the last one which we started in 2023 at Damonagar in Kandivali East. At RFIT, we have 4 main verticals. The first, which is the biggest community intervention program through our 8 community centers in the midst of the urban slums. The second is our Ummeed Health program, through which we work with chronic kidney disease patients across the Mumbai metropolitan region. Our third vertical is our work with youth through our Utkarsh Youth Development Program. We have volunteering, giving back to society as a core, and scholarship support for higher education is the base of that program. And the fourth vertical is a capacity building program, which we do through a training center, which focuses on entrepreneurship development. When we started on work on health, it was with a primary focus of financial assistance for patients as they cope with long-running and high-cost treatments. High-cost treatment and long-running ailment hits a family. I think it changes the socioeconomic fabric of the family completely. Gradually, we came to understand that the way that people know about cancer, the way people know about HIV, the way people know about TB, because the government has a program on that. CKD, chronic kidney disease, is something that people don't know so much. And unfortunately, a person with kidney failure is saddled with lifelong treatment costs, even if they are fortunate enough to get a kidney transplant, which less than 1% of kidney failure patients are fortunate enough to get. But despite that, they would be saddled with lifelong costs. So we went deeper into this issue, and today we work with chronic kidney disease patients across the Mumbai metropolitan region. We are probably the only organization that does issue-based work with CKD patients. When I say issue-based work, I mean that we've done advocacy, we've managed to influence policy, we've done path-breaking work by linking transportation and health. A kidney failure patient who's on dialysis needs to go to a dialysis center at least twice or thrice a week. these families and these patients struggle to manage the treatment cost, even in low-cost dialysis centers. But they're also saddled with a huge commuting cost. And most of them, despite their health issues, still use public transport. Now, healthy people getting into trains and buses in our city is a challenge in itself. Now, these patients with their fistulas implanted in their arms or whichever part of the body, mostly it is the arm, or if they're catheters, which are tubes which are hanging around from their thigh or the neck or whatever, I think commuting was cruel. And today, across 7 municipal corporations, we've managed to get them facilities of access to disability seats, of concessional travel. So I think that has been one area of path-breaking work that we've been able to do. Everybody's focus is on the patient, but I think the family also suffers a lot. So we have the Ekta support group of CKD patients and their families, which is a 5,000 plus strong group. And we've nurtured a volunteer cadre, which is now capable enough of taking up issues, be it with the government, be it with people's representatives, be it with issues that affect treatment costs or access to treatment. Women in our city live a pressure cooker existence. I think the day starts with pani kitne baje aayega, who in the family needs to take which local train, leaving at which time to be able to reach their place of work. What time do the children need to reach school? When do the elderly in the family need to be taken care of? So it is the woman of the house that is anchoring all this. And I think in this process, she's forgotten herself. So these centers are a safe space which these women, we have to do a lot of motivation, that focus on yourself, take out a little time for yourself. But once they do that and coming to the center becomes a habit, then I think the process of development begins, because we have a very activity-centric model where there are a range of skill trainings and health initiatives, and we weave in processes which lead to their empowerment. Since we began our journey in 2003, we have benefited more than 9.9 lakh people. In this journey of 21 years, we've reached out to more than 30 lakh people through our outreach work. We've supported more than 5,500 students at the higher education level, more than 18,000 patients for long-running and high-cost treatments. We started a community need response initiative since COVID, and we didn't stop that. And through that, we have been able to support more than 3.5 lakh people. If the community doesn't need us, we have no right to be there. We are also blessed with a very strong volunteer cadre, be it from our community center, where we have a strong, more than 100 strong cadre of women volunteers, plus a 30-40 group of youth volunteers from the bastis that we work in. We also have our Utkarsh youth volunteers, which students volunteer along with their academics. And this is a value that we rigorously instill of giving back to society. And we've seen over a period of time, more than 20 years of our existence, is that these children, they've gone to different parts of the country, different parts of the world, but these values have remained with them of reaching out to others. And I think that is a very satisfying part of our journey. As NGOs, we always talk of impact, and they are living that impact. And I think the most powerful is our patient support group. From within the Ekta support group, despite having a patient in the family, some patients themselves are volunteers, and quite a few family members are volunteers. And what drives them is that we don't want others to go through what we have gone through ourselves. If we had taken care of our health at the right point of time, or if we had the information, or we were fortunate enough to have had correct medical treatment at the right time, then today we would not have been in this situation of being a kidney failure patient or a family member of a kidney failure patient. And that is a very, very strong group. And there again, if we talk of impact, I think we are fortunate enough that family members continue to be our volunteers, though the patients have passed on. CKD has a very high rate of mortality, unfortunately, but the family members have stayed with us. So I think that has been the most fulfilling part of this journey.